Well, a special birthday for a law that continues to generate lots of controversy. Obamacare will be 5 years old on Monday, and millions have opted to enroll for the Affordable Health Care Act. But a new Senate finance report says despite promises that the plan would save taxpayers lots of money, there's news that billions have already been wasted. We caught up with Senate Finance Chairman Orrin, who tells me the real costs have not even begun to kick in, and he believes it's going to take a big toll with families and their premiums.
$5.7 billion wasted, and that's just the beginning. Plus, a lot of the costs haven't kicked in. People are surprised to find that they've been overcharged now. It's going to be very difficult for most people. It's going to amount to a pretty big percentage of what their possible returns are on their income tax pages. But in any event, it's going to alarm a lot of people.
As I understand it, too, 1.2 billion of that waste centers on the state exchanges. The fact that many of the states wasted a lot of money trying to set up their exchanges, and the fact that there are some defunct exchanges at this point, and so much was caught up in terms of just trying to get this thing going.
That's right. The whole $5.7 billion that's been wasted is a low figure. It may be more than that, but that's at least what they have to admit that they've wasted so far. I think we ought to be better stewards of the public's money.
So much hinges, of course, on the Supreme Court decision that we're expecting this summer.
Yeah.
And should that happen, I know you have a plan in place. If the Supreme Court votes to say that the subsidies are unconstitutional, that you have a plan in place that would be a viable alternative, and one that would not really strand people who are already in the plan.
Well, that's right. We know that if the court comes down against the government and against Obamacare on that particular case, that we're going to have to come up with an approach that will help people to get through the problems that will naturally arise. So we've got a whole plan on how you do that, and it's going to be very difficult, but it'd be the right thing to do. I don't know what the court's going to do. They may very well just say it'd be too much of a disruption, but they'd have to ignore the plain law, because the statute is so clear that only the states' exchanges can get the subsidies. And if the court does decide that, then we have to be able to provide a transition or a bridge period where people aren't going to lose out until we can resolve this problem. And hopefully we can resolve it by correcting a lot of the ills in Obamacare, or else repeal Obamacare and come up with a program that really will do a much better job at a lot less expense and cover everybody.
And if the Supreme Court does not find any of this unconstitutional, what then?
Well, if they don't, it's going to still be a big fight, because it isn't going to work well. People are going to get very disgusted with it. It's going to be hugely costly for them. And frankly, we're going to have a lot of irate people around here. And you know, the administration cherry picks items where Obamacare, any health care bill would be good, like keeping young people on their parents' policies till age 26. Well, we would have done that too on a real health care bill. Or like, you know, any number of things that it's easy to cherry pick, but when you talk about the overall costs, the overall burden, the overall bureaucracy that's created, the overall, you know, mess that it's creating, and the overall taxes that people are going to have to pay because of it, it's devastating, and it's going to get more devastating. People haven't even seen the costs.
Well, you know, interestingly enough, we have a recent Fox News poll that already shows that 58% of the population right now has an unfavorable view about Obamacare at this point. As you're pointing out, the real costs haven't even begun to kick in.
Well, that's right. Some of the real costs don't kick in for another year or so. I'm so disgusted with it, it's just unbelievable, because we were willing to work with the administration to try and come up with something that would be far superior, but it would have had at least some conservative roots that would watch the dollars and make sure that the health care that's given to people is health care that works.
But the higher costs go towards those who are not part of the subsidies. People, a study that I found from the Manhattan Institute, for example, said that people that have to pay into it find that they're paying more for those plans as opposed to what they could get on private insurance on their own.
Well, that's right, and I have to say that there's no quick answer to the mess that we're in. other than I hope that the court does find the government to be wrong. And if they do, then that gives us an opportunity to bridge this while we completely do a recast of what has to be done. And if we do that, we would provide much more responsibility for the states, which of course know more about what their people need than the federal government.
And this note, Senator Hatch has served in the Senate since the late 70s and has interacted with many White House administrations. Tomorrow on America's News Headquarters, we will talk to Senator Hatch about the growing divide between Capitol Hill and the White House and why he feels right now the atmosphere is the worst he's ever seen. That's coming up tomorrow at 1 p.m. Eastern.